I have an exciting couple of weeks coming up. I'm at my plastic surgery appointment, and Megan's getting married in 2 weeks. So Dr. Proctor referred me to a plastic surgeon. It means that this is the second step after the bariatric surgery so that I can see about getting all the skin removed.
I'm Katie, I'm one of the nurses.
Hi,
it's nice to meet you, come on back.
Seeing this plastic surgeon is going to change my life in every single way. I get to see a plastic surgeon and have them actually talk about removing stuff and adding stuff.
Hey, Vannessa, how are you? I'm Amy Alderman.
How are you doing?
Welcome, it's nice to meet you. My name is Amy Alderman. I'm a plastic surgeon. I like meeting early in the process to give them hope, give them things to get excited about, because once we get them to that ideal weight, we can tighten up that skin and it totally transforms them. Your surgery, you had gastric bypass. How long ago was that?
Yeah, like 10 months ago. Yeah, not even
wow.
a year yet.
Fantastic. And how much weight have you lost so far?
A little over 200. I'm like
Okay.
204 right now. that I
Okay,
lost.
that's amazing. Tell me what your primary concerns are.
My folds. I get rashes. I get broke out really bad in my folds. Massive issues is, I would say, stomach, vagina, tits, and arms. That's where we at.
Got it, I understand. I'm gonna step out and I'm gonna let you change.
Okay. The reason I want all of these things fixed is I want to look normal. I don't want to have any extra skin. I don't want that. I just want to look beautiful.
You have lost a lot of weight. This is hard to carry around.
It
right?
is.
I'm just doing one side. I haven't even done the other side. You know, this is a good 20 pounds probably.
Good God, really? Even you holding that gives me
It probably feels better. You want me to stand here and
There
hold
we
it
go.
for you a
Let's
little
just
bit?
take you home with me.
All right, hold that up for me.
Now we see the penis and the balls. Since I lost the weight, my vag is all just skin. So you got to think, it's skin like that just hanging between my legs. So it looks like I have like a 3-inch penis with these big old fat balls.
So we'll want, when we do your paniculectomy, to do what we call a monsplasty, and that's basically lifting this tissue up. So Miss Kitty's back up where
Yeah,
she
it looks
should
like
be.
she's I look like I'm a girl again.
So the other thing, Vanessa's, you know, you can do what's called a lower body lift. It means we go all the way around. And basically all of this is gonna be combined into this. And it's gonna, see how it raises your little behindy up?
I still have no butt.
You have a cute little butt.
Little one. They're gonna have to cut all the way around. It's right now kind of incomprehensible because the simple fact that I don't understand cutting my entire body in half. I'm gonna do it, don't get me wrong. I know that it's a procedure, but when she talks to me about it, it is scary.
So Vannessa, take a look in the mirror. When we do it's called a brachioplasty or an arm lift. We're gonna get rid of your little wing here. An incision goes on this part of your arm. Show me your guns.
Oh my God.
Look at that. What do you think about that?
It almost makes me want to cry. I mean, that's a typical arm.
You can run around Atlanta in a little tank top.
I've never in my life imagined myself looking like that, let alone now it's an actual possibility.
Breasts, we need to do a breast lift, but we're gonna make your nipple come way up here again.
Yes, like where it's supposed to be. Once I started realizing myself in a mirror, I seen a beautiful, gorgeous queen. And by having this surgery, it's gonna make me actually be the person I want to be.
Now, before we do any plastic surgery procedures, you wanna know what I need you to do? So the safest is if you get to a BMI of 30, which is about 180 pounds. When it's above that, you have a higher chance for infection, wound healing issues, blood clots, things like that. Higher risk for complication, for sure. The other thing is we don't do the skin resection right when you get to that weight. So I want you to wait a bit. It usually takes a year and a half to get to your ideal weight. And then I want you to be there for at least 6 months to a year to stabilize. Because if you do a skin tightening procedure and then you lose more weight, it's gonna not help my results.
A year? That's a long time. I was kind of hoping to have the surgery quicker. It makes me worried to death because if I do make it to the 180, being able to maintain 180 for 6 months. I'm gonna do my best. I'm gonna try so hard, but I don't know if I can do it. I really don't. And I don't want to be the fat bat for the rest of my life.